Hey, AP here. I'm a physician and work full-time in a hospital. I see ICU and other floor patients. When I'm off, I try and make these videos, so I hope you like it. By now, I've heard of many different treatments mentioned for COVID-19, including hot water, UV light, and disinfectants. Can disinfectants be actually used to treat COVID-19? You pretty much know the answer, but let's take a look at what can happen to your body when you ingest these disinfectants. We've been using them to kill bacteria and viruses, including COVID-19, on different surfaces, floors, and other objects. So why can't we just use it on ourselves? Well, because, surprise, surprise, it can kill you as well. And if not, it can still leave a permanent damage to your body tissues. There are many different types of disinfectants, which range from acidic to alkaline. Most of the commonly used are alkaline, such as bleach. pH is usually above 7, often in the range of 10 to 11. These are strongly oxidizing and very corrosive to your body tissues. You may wonder why spilling bleach on your skin doesn't cause burns, but you have to remember that the mucosal tissue in your mouth and in your GI tract is way more sensitive. After the ingestion, the symptoms depend on the total volume of liquid ingested, the duration of exposure, and the concentration of the liquid. Initial symptoms can range from sore throat, vomiting, drooling, abdominal pain, dysphagia, and odynophagia. These literally mean difficulty swallowing and painful swallowing. Your lungs are way more sensitive compared to your GI tract, and so the damage would be much worse if your lungs are involved. Your mouth is quite resistant, but you can still have ulcers if large amounts are ingested. Your esophagus is usually affected more than your stomach. It can cause what we call liquefactive necrosis. It causes rapid injury through your esophageal mucosa, which extends to deeper layers of your esophageal wall. In severe cases, it can cause perforation in your esophagus. That means the organs in your mediastinum, like your heart and lungs, can be directly affected because now they're in direct contact with your GI tract. Perforation can cause severe infection and shock, and it can result in death. It's a surgical emergency. So as the time passes, your esophageal cells start dying, and it can result in hemorrhagic ulcers and necrosis. Eventually, over time, scars can form in your esophagus, causing you to have strictures. These strictures are what causes difficulty swallowing, and it may require you to have endoscopic procedures throughout your life. And in severe cases, complete removal of your esophagus may be required. It's called esophagectomy. In that case, they would take a part of your colon out and replace it for your esophagus. Your stomach can also be affected just like your esophagus, and your stomach can also have a perforation, and it can result in death. Treatment for non-severe cases usually involves dilution with water and sometimes with milk. In severe cases, endoscopy is usually required to see the extent of the damage. In more severe cases, you may require intubation and/or surgery. In long term, if you develop esophageal strictures, you may require endoscopic dilations for years. So, to answer your question if we can use disinfectants to treat COVID-19, of course not. Please don't do it. As a matter of fact, just read the caution message on your Clorox bottle. Thank you for watching this video, guys. If you liked it, please like, share, and subscribe. See you next time.